One of the most common reasons for this is this. A pear-shaped organ called the gallbladder. It sits just beneath the liver and stores bile that helps your body digest fat. But when it becomes diseased, it can cause pain and other symptoms and must come out. But now, for many of the 1 million people each year who need gallbladder surgery, there's a new high-tech option.
There's less scarring, less visualization. In some cases, you can scarcely tell that a person had an operation once they've recovered.
Dr. Ben Schneider at Beth Israel Deaconess Medical Center was the first in Boston to perform the procedure, called a single-site robotic cholecystectomy. Traditional open gallbladder removal involves a 6-inch incision under the right rib. Nowadays, about 90% of gallbladder removals are done minimally invasively. The surgeon makes 3 to 4 1 to 2-inch incisions, so scopes and other tools can be carefully placed to view and remove the organ. But with this new single-site surgery, 1 incision is made at the navel, and all instruments are placed there through 1 port.
The way that we're able to perform single-incision robotic surgery is that the instruments are actually flexible, which is a completely new concept compared to what we currently use. Right now we're basically using chopsticks, and you think about it, they're rigid. We are working in the confines of a single incision, and we don't have room to bend our elbows, but what we do have are bent instruments that are able to bend, and then what that allows us to do is not cross or collide our instruments. So they're coming around at angles so as not to collide with one another. And that's really the clever part of the robot.
The robot also provides a better view of the area, maximizing accuracy.
The robot affords us the ability to see in stereo, in binocular vision, rather than through a single eye. We see in 3-dimensional high definition, and that's great in terms of visualization, seeing what we need to do the operation safely. That's a big advancement. It's very clear. It's shocking when you go back to standard laparoscopy afterwards.
As with any surgery, there are risks, infection and blood loss, although with 1 small incision, the concerns may be less. There may be an increased risk of hernia. Some patients may also not be a good fit for the robotic procedure, including those who are obese. So far, studies suggest most patients have similar outcomes with the robotic surgery as with the minimally invasive technique, but less scarring and with 1 incision rather than 4, a quicker return to normal activities.
The advantage of that is less scarring.
The single-site gallbladder surgery is the latest procedure to be added to BIDMC's menu of high-tech robotic surgeries. Others include single-site colon removal, robotic procedures for pancreas, gynecological cancers, prostate, kidney, and lung disease.
The question is, what will the robot allow us to do next? And we won't know that until we push that boundary a bit.